please welcome to the stage Jimmy Childre, Dr. Mary Klotman, Dr. Tim Lieuwen, and Dr. Tim Denning.
Okay. I'm Jimmy Childre, and it's an honor to be moderating this panel today. I am the president of Childre Ford and the past chair and CEO of Washington County Regional Medical Center. Now, you probably figure being a Ford dealer and the CEO of a hospital don't go together. There's a story behind it. It's my honor to moderate today's panel focused on funding the future, university research and action, partnering to fuel discovery and innovation. And this is not your typical healthcare panel. We're here to explore what's possible when medicine, engineering, and industry cross boundaries to fuel discovery. The funding landscape is shifting. With federal support less predictable and alternative sources gaining importance amid rising global competition, history has shown us that moments like this often spark creativity, collaboration, and innovation. In the Southeast, we are fortunate to have leading universities, statewide alliances, and growing industry hubs. We're positioned to turn funding constraints into opportunities, and opportunities into breakthroughs that matter for patients. This morning, you'll hear from three leaders who are proving what's possible when we approach funding with a growth mindset and a spirit of partnership. So welcome, panelists. I'll introduce you. To my right is Dr. Mary Klotman, Executive Vice President for Health Affairs at Duke University and Dean of Duke School of Medicine. Mary is reimagining how academic medicine trains physicians and drives discovery. Next to Mary is Dr. Tim Lieuwen, Executive Vice President for Research at Georgia Tech. Tim oversees one of the most dynamic cross-disciplinary research enterprises in the nation. And on the end is Dr. Tim Denning, President and CEO of the Georgia Research Alliance. Tim has helped build Georgia's thriving ecosystem connecting universities, government, and industry. Together, they represent the power of science and innovation at the intersection of medicine, technology, and policy. So let's dive in. Mary, the first question is for you. Innovation often happens at the intersection of disciplines. How is Duke leveraging collaborations across medicine, engineering, and technology to transform care delivery?
So first of all, good morning to everybody, and thank you for inviting me to this discussion. There isn't a problem in medicine that we can solve today without having multiple disciplines involved. So that's a given. The complexity of the problems and also the opportunities when you go across disciplines is really the future and currently how we approach it. So at Duke, I've always had kind of this really, I would say, simple approach, which is I call the One Duke approach, which is if you're at a university or an institution that has the opportunity to work across disciplines, you really need to take advantage of that. And every new recruit, I say, the way you're successful here is you go out of your discipline. You look across the campus, computer science, engineering, whatever it is. And in many ways, that is how we recruit to an institution like Duke. It is part of our selling point that you do have that opportunity. So the way I manage that is, first of all, lower the barriers for collaboration. And many of our higher education institutions, there are layers of barriers to even going outside a department versus a school or going outside a health system into the university. But the other approach is to incent, and to incent collaboration through things like internal opportunities for funding when there's a complex problem that you want a multidisciplinary approach, even to the point where we say in order to get this funding, you actually have to bring in a new discipline to your field to really incent scientists to look at other disciplines as partners in the problems they're trying to solve. So the great example that I love to talk about is the intersection between neuroscience and engineering. It's really quite extraordinary. And so a couple of years ago when we had a new initiative to focus on science and technology, we really partnered outside of our school to recruit faculty in and one area was the intersection between medicine and engineering, which is obvious, the opportunities there. And it's extraordinary what bringing in a few faculty that see the opportunity of that collaboration, what that does to fueling a whole new area of medicine. So I think it's essential. I think there's no way we're going to solve complex problems without multidisciplinary approaches. I like to say science is absolutely a team sport, but sometimes you have to facilitate it.
Jimmy, I just add that beyond what Mary said, which is absolutely central to what universities are doing, also between universities and across states and even regions, to really have those close collaborations, but that focus on different disciplines is absolutely key. That's something that Georgia Research Alliance, what we really try to do here in Georgia, is broker those partnerships, not only within the universities, but also between the universities. And then beyond the universities, so university industry partnerships, which we'll probably talk a little bit about in the future as well. So I think those are all really key to build this very robust ecosystem, and how you can promote solutions more rapidly and effectively is through this partnership. And there's this spirit that's really required for this. And that's a spirit that has to have structure associated with it. It's got to have strategy, but then you also have to have the people who really want to do something greater than just the individuals can do.
Yeah, I would say at Georgia Tech, we've spent a lot of time thinking around how do we build structures and sort of organizational design to facilitate this. So about a decade ago, we set up a structure which we call Interdisciplinary Research Institutes. And actually, Julia Kubanek, who's in the audience, is our vice president for interdisciplinary research that all of these report up to. And the idea was, okay, so a big place like Georgia Tech with thousands of students, thousand faculty, how do we sort of distinctively build all of Georgia Tech system integration around big societal issues? And so we have an Institute for Biotech and Bioscience. We just established an Institute for Neuroscience and Society. We have an Institute for People and Technology. But all of these, and my prior job before this was running our Energy Institute, but the whole idea was essentially what we've tried to do is matrix out our research organization. I'll talk a little bit more about this later, but we have a $1.5 billion a year research organization really organized around traditional academic verticals, chemistry, biology, and so forth. But our interdisciplinary research institutes are distinct structures where we've spent a lot of time thinking about incentives and not creating the wrong incentives or the wrong types of competition to really build all of Georgia Tech solutions around big issues.
Well, Tim, while you're on this, we hear a lot about engineering and AI and how that will reshape healthcare. Where do you see the biggest opportunities for engineering, AI, and the bioscience you just mentioned to intersect and then transform care in the foreseeable future?
Yeah, so maybe I'll just quick introduce myself. So first of all, delighted to be here. And by the way, I'm a mechanical and aerospace engineer who's used to thinking about combustion and rockets, so I know the least about this topic than anyone. So I'm gonna stay at a very high level here. But I think for one of the other questions, I'll use an example from aerospace. But I think at Georgia Tech, so we're the largest research university in the United States without a medical school. And I'll talk about that in a minute as well. But really, as part of and so a very engineering, science, national security heavy portfolio. But we have been working on healthcare issues, bioscience issues, life sciences issues for a while. And I mentioned Julia earlier, Dr. Julia Kubanek, but she's actually leading something we're calling the Medical Innovation Hub, which really, again, is to try to roll up all of our activities in this space. And I think, again, we don't have a med school. We don't have plans to have a med school. We have wonderful partnerships with Emory. In fact, we have a joint department with Emory. We work really closely with Children's Healthcare of Atlanta, work really closely with Wellstar. We're excited about the University of Georgia having a med school and working with them. But just the idea that for a place like Georgia Tech that has this very large engineering, more systems thinking, we think that there's a lot that can be done kind of taking this broad, complex systems perspective. And if, the kind of problems that we're used to working on are complicated supply chains, where you're optimizing across systems which are big and complicated, where you have regulatory impacts, policy impacts, human behavior and human incentives play a significant role. So that's one part where we're really trying to think about how we can support and help the healthcare industry, is bringing that rigorous engineering, complex systems perspective. And then the other one I would say is just very, very deep verticals around AI, around robotics, around imaging, around neuroscience, and bringing those to bear.
Okay, well, thanks. Tim, your organization, the Georgia Research Alliance, connects business, government, and universities. How would you describe GRA's unique role in fueling growth for the state's innovative ecosystem?
Yeah, so I've been at Georgia Research Alliance for about just under 2 years now, and when I started out, one of the first things I wanted to know is, what are kind of the benchmark other organizations like GRA that exist throughout the country, and what I quickly became aware of is that there's nothing really just like GRA. There's organizations in other states that have specific aspects that are shared with GRA, but there's some real uniqueness, and a couple of the points I'd like to highlight is, number one, it is this true partnership between the state, the universities, and the business community. And that first component, the state, is really important. So we are funded by the state for our programs. And that's really essential because we are not functioning and have never functioned like a venture fund or a venture arm. We're really an economic development and a workforce development engine. But what that means is our mission is to drive impact in the state of Georgia. We are not driven by returns, we're driven by impact. And so that's really, really unique and fundamental, I believe, for what GRA does, because to drive impact then, we just need to figure out the very complex, how do you drive that? And we drive it pretty much stem to stern early on, from ideas to innovation to then impact. And so ideas, where do you get ideas from? From really smart individuals. So what do? We partner with the universities to help to recruit those smart individuals and teams. Then to get that innovation, you've got to enable those smart folks. You've got to give them the cutting edge tools, instrumentation that they need to make the cutting edge discoveries. And then when they're doing that, they need to start have a path forward to get early seed capital, when a lot of federal and other sponsors are not going to invest in high-risk projects at that stage. So that's where we come in, and we provide some of that early key funding, as well as mentoring and advising, such that projects, the ideas, the innovations can start to flourish, they can get de-risked, create value, and start to move forward, ultimately outside of the university, into a Georgia-born startup or a Georgia company. And again, that really thrives the ecosystem here. It thrives our rankings and our reputation, our economy, our workforce. So all of that is done by Georgia Research Alliance. And so we're very unique in kind of covering that entire breadth across the state of Georgia. We actually cover all disciplines of research. We're agnostic to research discipline, although a lot of our portfolio is in health.
So what we've heard from all three of you, interesting to us, is that collaboration is critical for vision, competitiveness, and impact. Mary, let's go to the next round of questions. And this time I'd like for us to think about innovation and partnerships. Partnerships are everywhere in medicine today. What does a healthy and impactful partnership between academia, healthcare systems, and industry look like, especially when the focus is on patients?
Well, you're right. One theme of everything right now is building those partnerships. By the way, I love the regional approach, and I think that's a great model for all of us to think about as we're thinking about efficiency and leveraging our resources. And I think we could all learn from the regional approach that you've developed. So what does a healthy partnership look like? You have to figure out how you align around incentives and shared priorities. And ultimately, that will fuel the ability of partners to come together. I like to use two examples of where I think it's worked extraordinarily well, and we have to figure out how we can capture those examples going forward. One is Project Warp Speed. I mean, that was an extraordinary partnership. You had academic institutions that had already developed the clinical trials infrastructure to be able to take anything developed and rapidly test it in clinical trials. You had production. It was industry, it was government, it was academic institutions, and it worked. And the other is the field that I've been in all my career, which is HIV/AIDS. That was an amazingly difficult challenge when it started. We didn't even know what the cause of AIDS was. And fast forward now, it seems like a long time, 20 years, there was essentially a lifelong treatment that really provided the ability for individuals to live a healthy, long life. And that was, again, a partnership. It was sponsored research, our government. It was academic institutions willing to train and support the research needed to get to where we need to get, and industry coming in and developing the drugs. So those are two great examples where I think everything, whether it was purposeful or not, everything was aligned. And so it is, in my mind, no question that that has to be the model for the future, but we also have to think about, well, why doesn't it work? And where can we think about bringing in partnerships that have traditionally been difficult to build?
Tim, I'm going to ask you to pick up on that. Georgia Tech works closely with industry. Everybody that lives in Atlanta knows that. Can you share an example of a partnership in biotech or medical tech or digital health that's delivered measurable value? And here's the more important follow-on. How do you evaluate the impact?
Yeah, so I think, first of all, I'd say I'd start by, when we talk about partnerships, I just, again, want to talk about, I'll start with internal and how we organize ourselves, and then I'll talk about some of the external partnerships, because it directly applies to how we partner with industry. But as part of my portfolio, we have research, we have all of our commercialization activity, which includes both student startups, faculty startups, but any startup in the state of Georgia, which, as well as our economic development, our activities to support small and medium-sized manufacturers, rural healthcare systems, things like that. And so really a lot of thought and effort we've gone into deep integration of sort of the education, research, economic development, and commercialization mission, where those are really truly drawing value on each other, which I can add on more later. But if I talk about industry partnerships, first I just want to do a big, we're still kind of excited in the afterglow. There was a big Wall Street Journal profile of Georgia Tech's sort of approach to working with industry. And where that started with was the reporter reached out and said, hey, with all these federal funding cuts, do you see industry coming in and trying to backfill? And I said, well, not really. Industry is not really in the philanthropy business of although we have, with that said, we have spent a lot of time thinking around deep, long-lasting, mutual value-add partnerships with industry. So we actually have a pretty well-developed system. We measure our engagement with industry around 9 points of engagement. This is student recruiting, this is training, training and upskilling, this is research, this is access to specialized test facilities. And so the idea, when you're working with a company that ultimately is responsible to a shareholder or someone for making money, you need to make sure that you structure that partnership so that you're both helping shield them for truly disruptive things over, let's say, a 5-year or a decadal time frame, but you're also delivering real value over a 6-month time frame. So we spent a lot of time thinking about how do you structure a partnership where there's just a lot of connection points and a lot of value add. So I'll give you a couple of quick examples. So Children's Healthcare of Atlanta is a wonderful partnership for Georgia Tech, where our engineers and scientists work really closely with clinicians. They identify real-world, very specific issues, come together, work together, and those are saving lives. They are saving lives right here in Atlanta. We've got a great partnership with Medtronics around neuroscience, brain implants, some really cool things that we're doing around cell-based manufacturing, working with a lot of companies around regenerative medicine and advanced manufacturing.
Good, thank you. Tim? When I think of your organization, the GRA, I think about the great collaboration. So you're the collaborator. Across your network of universities, what do the very best collaborations have in common, and what differentiates those that changes lives versus those that look really good on paper?
Yeah, this is a great question because it really gets to the heart of the issue. I've been part of collaborations throughout my academic career, good and bad, and I think the common theme that I've learned over the years, again, through academia, but also at Georgia Research Alliance, is that the real, true, powerful, impactful collaborations and partnerships come down to the word transformation instead of transaction. So again, I think many of us have been part of working together with teams or other individuals where it's very transactional. I need a letter of support from you. I need you to do this experiment or this service or whatever it may be from you. And then you agree to do it and you do it, and that's fine. But that's not what is really unique and powerful to really accelerate impact. To really accelerate impact, you need that transformational change. And the transformational change comes from getting a team together where people want to have impact. That is the North Star. The North Star is not publications, it is not grants, it is not upside financially. It's really like, we want to solve this disease, and we know that we're just one piece of the puzzle, and we need a team around this table and likely beyond this table in this university to really impact this. And so to go through the effort of reaching out and building that is what's super key to these really important collaborations and partnerships. The other element I would just say that I've seen that's a common denominator is a strong sense of humbleness. Many of us in this room, well beyond, are experts in our unique disciplines. But to be humble enough to say that that in and of itself is not going to be able to solve an incredibly complex problem, disease, disorder, whatever we're working on. We need to say, I know this really well, but I need to partner with somebody else who knows that really well. We need to start to have at least minimal overlapping dialogue and understanding of what one another do, and then work together to do something, so that if one person's going out and presenting this, that I would be so proud that I'm not in the spotlight, but I was part of that. And so I think that is really the power of transformational change and collaboration. Those are the ones, that's the secret sauce.
So this is good. So I think what we've heard is that innovation is amplified when partnerships are both purposeful and patient-centered. For our next round, I'd like for us to shift our topics and think more about the funding aspect. At the heart of research and discovery is the responsibility to use resources efficiently. If we didn't understand that before, we certainly understand it today. It's an understatement, isn't it?
Right.
In moments of challenge, the United States has often turned funding constraints into opportunities to innovate. So, Mary, I'm going to start with you to help us understand the funding landscape today. So, how can we strategically align funding opportunities to ensure patient scientists have the resources to turn their bold ideas into breakthroughs that actually improve patients' lives? Maybe you could talk about alignment of federal funding, philanthropy, industry partnerships, maybe even venture funding.
So you started by saying, given the funding landscape today, I don't know where we're going to land on the current landscape, but I do know, and I think all of us know, that being able to stretch our resources and be efficient with every dollar we get for funding our research is absolutely critical. So if you look at the intersection of multiple, what I call revenue streams, institutions, particularly institutions like Duke, have disproportionately relied on federal funding. And so a lot of our thinking today is, how do you diversify the revenue that you need to support science? And particularly, you mentioned the physician scientists. So a little bit about the physician scientists. The physician scientists, which I think is a critical part of the ecosystem of biomedical science, often physician scientists are driven by a disease area, and they come in to an area of science thinking about ultimately, what is that disease? For me, it was always HIV, it might be cancer. And it is a different point of view that helps formulate questions that are asked. So prior to our current unknown landscape of funding, institutions took a lot of the costs on of developing physician scientists. It takes years. It takes years before there's what you'd call any return on the investment, but most of particularly healthcare institutions have believed that is a huge ultimate payoff for healthcare. Philanthropy filled some of that, but there is also sponsored research like training grants. So what are we seeing in the future? I think there's going to be an interesting new opportunity to partner around training scientists and physician scientists. I'd like to see what's going to happen with industry, because in the former model, a lot of those early costs were borne by institutions and by the NIH. It may be that the future will be a model in which we partner with industry, because the pipeline for industry has been the PhD, MD, PhDs, and MDs trained at our institutions feeding into industry, and that was a healthy pipeline. That pipeline may dry up unless we figure out a different way to support the development of scientists. So I am anticipating and expect that there will be new partnerships, particularly around partnerships with commercial entities. I also think doubling down on philanthropy. We always say when we don't know how to fund something, we always say philanthropy. And, you know, in many ways, that is true. But in order to engage our donors, they really have to understand why we need the resources we need. And I would say physician scientists are a pretty easy story to tell that not everybody completely understands. So philanthropy, commercial partnerships. I don't know where things like government-sponsored training grants are going to land, but I think we're going to need to diversify how we support the development of physician scientists and scientists. And I'm hopeful those partnerships will be incented by the current stress that we're all feeling.
Okay. So, Tim, while we're talking about that current stress.
Don't know what you're talking about.
Yeah. Constraints often spark breakthroughs in engineering, and I bet you've got some examples. So can you share with us where you've experienced limited resources that actually accelerated innovation?
Yeah, I could reel off like 10 of them, but maybe I'll just give, I've got 2 examples that I want to give, and I think sort of this is a story I've been talking a lot about at Georgia Tech, because we have a lot of really nervous graduate students and young faculty, like, you know, is there a future for me in this, or how can we do this? And sort of one of the things I've been saying is, you have deep expertise not only in your specific field you were trained, but which is more broadly applicable. And so the example that I would use there is Georgia Tech School of Biomedical Engineering, which is our joint program with Emory. Great program, transformational program. But if you look at sort of the founding story of where that came from, the founding chair, Don Giddens, actually I knew Don because Don was the school chair of the School of Aerospace Engineering, which is the school that I grew up in at Georgia Tech, and his picture was always on the wall. So how did Don move over? Was Don went from, he was largely NASA funded, and his NASA funding went to zero over a 1-month time frame, and he had to sort of re-envision what he did. And he knew a lot about fluid mechanics. And so he morphed that into a significant expertise and program around fluid mechanics of the heart, which he went to Johns Hopkins, but he ultimately came back to Georgia Tech and became our dean. So I think that's a really cool story of just how these types of the expertise that we have, sometimes we have to dodge and weave a little bit around how to leverage it, but to keep the ball moving. The other example that I want to use, this is really more around partnerships. By the way, we're huge fans of GRA. It's like Georgia's secret weapon. It's had a transformational influence on Georgia Tech. But I think a great example of how we're trying to do more with less is some programs that GRA set up, is that we have, you know, doing research is expensive. It takes expensive, sophisticated facilities. We spent a lot of time developing what we call core facilities, which are facilities that aren't managed by a single PI, but are centrally managed, that provide even better service for a larger cadre. And so one of the things GRA has done is set up an arrangement whereby core facilities across the state, can't remember for the region, but coordinate and interact with each other. Tim's prior job, he and I had the same job at Georgia State University. Georgia State and Georgia Tech have a joint core facility called the Center for Advanced Brain Imaging, which again just kind of pulls together from what both are good at, and we manage those costs and the people.
Tim, the other Tim, how is Georgia? You know, I want to tell the audience, when we first put this panel together, I thought I would refer to one of the Tims as Georgia Tech Tim, the other one is Tall Tim. And then I realized they both were tall. So then I thought, well, I'll use Handsome Tim and Intelligent Tim. And now I've realized they both are both. So just Tim.
Tim L.
Tim L and Tim D. So, Tim D., how is Georgia turning today's funding environment into a growth opportunity? And how is the state collaboration positioning the state of Georgia as a national model, even during this time of tighter budgets?
Yeah, another great question. And I should just reference the last point here. It's Tim Lieuwen and I are very close colleagues. We communicate regularly by text and emails, and so it's almost like a bit of an existential crisis when I'm sending emails. Dear Tim, signed by Tim. It's like, am I just referring to myself in the third person? So, again, this is a moment, I think, in time that while we're all very concerned about the uncertainty of the research landscape and federal funding, et cetera, is anytime there's a scarcity of resources, this goes back to caveman era, of course. Whenever there's scarcity of resources, you've got to work together to figure out how to move the needle. And so when I think about Georgia in particular, because that's our mandate, of course, is how can we knit together the assets around the universities, beyond the universities, investment community, you name it. How can we come together to do more with less? It's a really hard, challenging topic. And as you just heard, it's incredibly expensive. For those of you all who don't work deeply in research, it is incredibly expensive. It's incredibly expensive to recruit talent, to invest in that talent, to grants, you name it. And so what we have to do is, again, what you just heard a little bit about, is how can we stretch the resources further collectively? Instead of, if we need a cutting edge instrument at Georgia Tech and we need one at Georgia State, if that's the same instrument, these two universities are separated by a couple of miles, that doesn't make a lot of sense, right? There should be one instrument, it should be shared, and so this is where we really try to broker these deals. We work with the universities, legal teams, set up MOUs that are signed off on so that you could do just that. A Georgia State researcher could go to Georgia Tech, use their core facility for the exact same internal costs that is charged to internal Georgia Tech faculty, and vice versa. And so this is where I think we need to focus. I'll talk about Georgia, but it's really the region, it's the collective nature of research in this country, this is a time where we need to look deeply at what can we do together as opposed to more independently and then coming together later. We've got to look at first step, whether it's a next grant going in. Again, I think there's going to be a pivot away from, completely away from, but maybe less investment in individual investigator research and more in team science. We've already been seeing this for years before the current era we're in. So how do you start to build those early, collaborating early, sharing resources early to address a topic? When that comes through, when I look at Georgia as an example, again, we have amazing assets across almost so many different disciplines. We have amazing industry here. We have so many assets. Are we leveraging those collectively as we should be? And the answer often is probably not, and now's an opportunity. While it's a challenging time, it's a real opportunity for us to do much better at that. And so to do it, I always come back to, I see so many examples and have lived through examples where those connections take place far later in the evolution of a project, of an idea, of an innovation than one would want. And you can start to fold people in earlier. That's really powerful.
So just to follow up on some of those themes, we've talked about team science now a couple of times. The culture of most academic institutions is not to recognize team science. Frankly, the culture of how we nationally recognize accomplishments is individuals. So all of us have to think about how do we change that culture. It starts with not only who you recruit, but how you promote within an institution. We've done a lot of work thinking about how do you recognize team science when you're evaluating an individual. But I would say nationally, we need to think the same way, is moving away from constant individual recognition to team science recognition. And it's difficult in the environments that we're in, and it's also a long-term recognition, because many of these accomplishments of some of the teams we're building, it's going to take years. And so it's not only the end that you recognize, it has to be the willingness to participate. So it's a change in culture.
So all three of you have talked about funding science being a challenge. It's never been easy. But also that we meet that challenge with our creativity, our resilience, and our partnerships. So for the final questions, let's look forward. Let's think about the vision, your vision. And in these next questions, I'll call this the lightning round. I'll have 2 or 3 questions, and please, anyone answer them as they like. If you had, this is back to the funding piece, if you had unlimited discretionary funds, what single area of health innovation would you invest in to transform patient care? unlimited funds, where would you invest? Mary, I can tell you're ready.
Well, I'm ready because I wanted to answer one of your previous questions. I'm going to cheat and give you two answers.
That's fine.
When you also asked about the promise of AI, and I don't think this is going to take an enormous investment because we're getting there, really restoring the patient-provider relationship. That is my dream. It has really eroded. The last 20 years I've been in significant leadership roles in healthcare, largely, not completely, but, the EMR and the amount of time providers, whether they're nurses, physicians, PAs, have had to move away from the patient. So my dream is that AI will absolutely transform in a positive way the physician-provider, the provider-patient relationship. Where I would put a lot of investment in, and I think is going to take a lot of investment, is in neuroscience. And not just for dementias and movement disorders, but behavioral health. And I really think the promise of neuroscience is how we get to a much more organized and rational approach to behavioral health.
Thanks. Anybody else?
I'll just riff off AI. I think because there's a lot of talk right now around AI and just around data centers and algorithms and just raw compute power and things like that. But I think one of the really interesting stories that's happening at universities like ours is just the broad-based diffusion of domain expertise and AI to solve specific problems where 1 + 1 is way bigger than 2. And so I think kind of my answer would be just around the promise of AI, and if we can, just around the personalization of healthcare. I think is just really, really exciting. It's going to take a lot of resources just around just data sets, dealing with the regulatory issues, but just whether it's the healthcare system or whether it's dealing with specific drug discovery issues or cancer treatments, just ultra-precise personalization.
Tim?
Very quick answer for me. It's actually two, but they're very overlapping. It would be unlimited resourcing. I would focus on rural health and maternal infant health. I think the investment, the dollars going into those areas would have transformational impact in a relatively short period of time. And so that's something that we think a lot about.
So we'll make this one quickly as we're getting close to time. What skills and mindset will the next generation of clinicians, scientists, and engineers need to thrive in an innovative-driven world?
They're going to need to know how to manage and decipher information. I mean, the amount of information available to our trainees, whether they're MDs, PhDs, is just extraordinary. And it literally is at their fingertips. But the skills they need to decipher what is good information versus disinformation or misinformation. How do they understand the evidence behind that information? So really building skills in understanding how information is generated, how it's validated, and then how, when they're using AI tools in particular, how do they decipher the validity of what they're seeing in an AI question to know that it is indeed the type of information they need to perform their experiments or to provide care to patients?
I would highlight two things. I'd say one is just systems thinking. Super important. It's just in this, we're spending more and more time just thinking about systems thinking around delivering value to the patient. And this is people who understand the scientific, the technical, the policy, and the regulatory. I think that's one. The other that I would highlight is just this entrepreneurial confidence. It's this, so we've done a lot of work at Tech around what we call CreateX, which is student startups. We start about 100+ student companies a year. Let's just say 10% of those are successful, but even those 90 that aren't, they have great outcomes as they move into the world of work from learning this entrepreneurial mindset.
I would just say we talked a lot about interdisciplinary collaborations, et cetera, starting so early during training, getting programs to start, students starting to work together, learn different disciplines early and often, how to have those conversations, how to build relationships. That's going to be so key to the future because that's the way the future is going to operate. It's going to be far less individual and far more partner.
Thank you. It's time for us to wrap up. I want to thank the three of you so very much. When we put this panel together, I thought, I don't know when I've ever been on a panel with the intellectual capacity of our three panelists here today, and it proved so. We'll take a time to have a quick summary. I think the overarching themes that we've heard is, one, a growth mindset can help with the constraints and spark innovation. Partnerships matter more than ever. across medicine, engineering, industry, and statewide ecosystems. And probably more importantly, the future is now. Today's investments, today's training, today's collaboration will define tomorrow's discovery and ensure we safeguard our nation's enduring strength in science, innovation, and care. Together, we're not just navigating funding realities, we're building momentum, sparking collaboration, and turning today's discoveries into tomorrow's cues. I want to thank you, our audience, for being here with us today and supporting our panel's discussion. I want to thank Health Connect South for having us and for putting on this wonderful conference. We're out of time, but please, if you'd like, come down. I've asked the panelists to stay and answer your questions individually and for you to get to meet them. Thank you all very, very much.